Look, good afternoon, everyone. Thank you for joining us. We're happy to take questions based on what you will have heard me announce at midday. What I want to first set out is that the framework from which the announcement was based is available at covid19.govt.nz. People can clearly see the alert system and the different expectations at different points in that alert system. What I want to acknowledge is that obviously there is great interest in the system and the information provided today. So there is increased demand on the website currently. I do just want to let people know this will be available on social media, a range of different outlets, and will continue to be available throughout the course of the day and obviously the coming weeks. In the first instance. For those who have direct health needs, please do look first at the website to see extra information about how it may affect you. Leave Healthline for those more immediate needs. This is one way that we can make sure that those who need assistance and support directly are able to get through. I say that having no information on demand on those lines, but certainly just anticipating based on what we've seen to date from new information in the community. For now, though, I'm Director General of Health.
When you went to Rotorua this week, businesses were talking about needing to rely now on domestic tourism. You're effectively cutting that off. Are you expecting that you'll need to ramp up the business continuity package exponentially?
When I visited Rotorua, one of the clear messages from businesses was also go hard, go early. That will also help protect our businesses in the long run, and that's what we've done.
Some of the risks to old people, I suppose, because they're now going to be people like 70 moving into effective isolation.
What we're saying to those who are over 70 years of age or have issues with immunity or some other underlying health conditions, that we are asking them to stay at home as much as they can. This is a simple measure that we can take to make sure that we limit the chances of their exposure to COVID-19. In turn, that keeps them safer and limits the resource that we might be needing from our hospital system.
What instances should people not travel domestically? In what cases do you think they can?
We're asking people to be very practical here. In this level of alert, we ask people to reduce their contact with others. So really just ask yourself that simple question, is this essential travel? Reduce that contact. If you do need to travel, keeping your physical distance at all times.
How quickly can we move to alert level 3?
Daily updates will be provided at the time the Director General sets out the cases for that day. He will also indicate any movement in our alert system. That it could apply to local areas or it could apply nationally. You could move both up and down, and that could happen at a daily notice.
What are the implications to alert level 3?
As you will have seen as we set out, restrictions at level 3 are through heightened risk that the disease is not contained.
What are the implications not at that point?
Sorry, I'll come to Jessica.
What are the implications for domestic travel for Air New Zealand with this announcement?
Air New Zealand have already anticipated some of these requirements. So what they're doing with their seating arrangements is to build physical distancing into their ticketing and seating.
And how closely will it be monitored? You know, effectively asking people don't travel if you don't need to. Will there be anything like road checks, or
we are asking people to take responsibility for their own decision making here. If we move further up alert systems, then that will change. But right now at alert level 2, we ask people to take responsibility for their decisions and make their own judgments. But please keep in mind, the more contact you have with others, the greater the risk.
It's widened up in Auckland on the verge of moving into that next level.
As we've said with this framework, you can have regions move up the alert level. The criteria we've given is if community transmission is occurring or there are multiple clusters breaking out. So we make those assessments as we have that information coming through. At this stage, though, all of New Zealand is at level 2. I'll come into the front. There's good time for everyone.
Are you working on the assumption that there is some degree of community transmission at this point?
As you will have heard the Director General state this morning, we cannot rule that out. Obviously, public health have undertaken their investigations with those who have tested positive, but they are still investigating some of their wider contacts. So we're letting them do that job. Right now, all of New Zealand is at level 2, but as you've heard me say, we do need to be prepared that regions or the country could move to level 3.
We see a shift to level 3 in the case of just one instance of community transmission.
I'll let the Director General answer that question.
What we need to do is look at, of course, not just any evidence of community transmission, but also what's happening around the country and where it's happening. And if, for example, we have a person who has done a lot of travel around the country and we can't identify exactly where that community transmission occurred, then we may look at the whole country. But generally speaking, we would be looking first of all just at that local community.
I think what we need to remind people is that in everything we've done so far, we've been willing to move on risk. We've been willing to move early to preempt potential growth in cases and waves, and we will continue to do that as we apply this alert system.
You talked about
Jessica.
schools. You talked about schools there and saying, look, kids will still be going back to school.
Yeah.
You have consistently said we're trying to move ahead of that
Yeah.
at the moment. So that's still the decision. Kids carry on.
And there's some very specific criteria that has been developed by the Ministry of Education to give people a very clear idea of when that will change for their school in their area. And so in alert level 2, if there is a case attached to a school, the school will close. There'll be contact tracing, 72 hours of thorough cleaning, and then the school will reopen. If we have wider community outbreak, that guidance may change, but I want to assure people, my number one concern, of course, is the school, the people who work within it, but the children as well. Breaking schools up now may not, however, reduce community transmission.
Would you start
Between community transmission and clusters that you're talking about, why is a cluster not community transmission?
I'll let the Director General answer that.
Yes, so a cluster may be related to a specific case where there is a link of overseas travel. So you might have a family cluster or even a community cluster where you can clearly identify an overseas travel link. So they are two separate things, but then again you may have a cluster that is around community transmission too.
At what point do you start shutting down places where people gather? So going one step further than the 100 plus?
Put out guidance, and actually the restaurants and bars have worked very closely with the Ministry of Health to put out very specific guidance at this stage of what they must do in order to safely continue to trade. It is very specific and detailed. But what I am clearly saying to people here today, at risk alert a level 2, reduce contact with others as much as possible. If you cannot go out and maintain 2 metres of distance.
How is the Deputy Prime Minister going to be affected? Sorry, how is the Deputy Prime Minister going to be affected by these recommendations for over 70s?
Obviously, the Deputy Prime Minister we consider part of our essential team and our core part of our government. And so, if I could just complete the question. And so, the Deputy Prime Minister will be continuing on in his role as business as usual, whilst applying the same kind of measures we are asking all parliamentarians to maintain at this time.
Simpkins is over 70, so shouldn't he be leading by example?
And as I've said, for the Deputy Prime Minister, he is part of our essential team. He will be continuing on in his work, but applying the same critical measures that we have asked others to take and to keep.
Only 2 days ago that the Deputy Prime Minister was saying that both he and David Parker may continue to travel overseas when needed in terms of trade relations. Would your expectation be that either that stops or in Mr Peters' case he wouldn't be doing that?
The government will not be travelling overseas.
What about other MPs? They travel around quite a bit.
Yes. I've spoken with the Speaker of the House this morning. My intention is that the Business Committee, that is where we have representation from across parties, will come together and formulate a plan for Parliament that fits with the alert levels that we have set. We are obviously in a recess that gives time for that plan to be worked through. I do expect it to be cross-party and for there to be consensus.
Will you be shrinking cabinet at all?
I have been working on contingency. That means that Cabinet can meet at least all together virtually, even if we don't have everyone in the same room. So I do want to start mitigating risks by breaking down the number of Cabinet members who are physically in the same space together at all times.
You mentioned certain illnesses and immune deficiencies. These people shouldn't perhaps be going out as much as other people. Can you be more specific about what sort of...
I'll give us a general frame and then I'll hand over to the Director General. So we've asked all those who are over 70 or have compromised immunity or certain other health conditions. Those certain other health conditions and greater guidance is available at the COVID-19 website, so that will go into greater specificity. There is, though, going to be some medical judgment involved. Someone, for instance, who is a severe asthmatic, this will apply to, but someone who otherwise may have much milder respiratory issues, then would be asking that they consult with their health professional so that they can ascertain the best plan for them.
The comment I would like to make here is that there's an obligation on everybody around people who are either older or have pre-existing medical conditions, because you may not know the person who you are with. For example, if you go out and you are unwell, you could be putting someone at risk, someone who might be receiving treatment for cancer and is immunocompromised, someone who might have an underlying medical condition like a heart condition or diabetes. So the obligation is not just on those with those conditions or on older people, it's on everyone to make sure they are not putting those people at risk.
Cabinet and the government starts moving to a more kind of virtual working, what are you doing to mitigate security risks?
Security in what way?
In terms of if you're not meeting together in a physical room, which is in lockdown where your phones are all banned, but you're doing things online more, how do we prevent hacking?
Yeah, and look, those are things that already within our Cabinet Committee structures, for instance, those are already utilised. So I'll just be making sure that I gain those additional assurances that all of those measures are in place.
Have you personally been tested just in case?
No. Again, I follow the same guidance that I ask the rest of New Zealanders to follow. I am trying to keep my physical distance from others. I'm frequently hand washing. I am reducing down my travel, as some of you will have already seen, and I've made the move to base myself here out of Wellington. Those are all measures I'm taking to make sure that I'm following the same guidelines that I'm expecting of everyone else.
How concerned are you that people just don't seem to be getting the message in terms of panic shopping?
I cannot reiterate this more clearly or firmly enough. We will continue to have food supply in New Zealand. The reason we have empty shelves is because our supermarkets are unable to restock quickly enough. When people panic buy, it doesn't allow time for restocking of shelves. It also potentially deprives someone who desperately needs a particular item from even being able to get one thing on their list that may be critical to them. If I can use an example, there'll be families who need formula. If we panic buy, that'll be a family who may need that immediately where it won't be available. Shopping must continue as normal. It will be available at every alert level. Even if we are in alert level 4, supermarkets will be open. We are working with supermarkets to make sure that that will be the case to support them to remain open. I say the same for pharmacies. Do not panic buy at pharmacies. Shop as you normally would. They will remain open and products will remain available.
With 1,500 tests processed yesterday, moving forward, do you expect that that many tests will continue to be carried out on a daily basis?
Oh, look, as you would expect, we are continuing to see those increases and we have the ability to increase capacity. Of course, there is more than just capacity though, there's people involved with all of those tests. So maintaining that is something that of course we continue to assure ourselves of as well. Just in terms of how many we're constantly assessing, it's as clinicians say people need to be tested, we are testing.
How much are you able to increase?
Do you acknowledge that we were too slow to start testing at capacity?
No, of course, as I said, that clinician discretion was there. We asked clinicians if they believed they needed to test, they did, and as you can see, they are.
How much are we still able to increase capacity by?
Well, we can increase the capacity of testing further if we need to. I just want to reiterate the point I make each day, that is, it is important that the right people are tested, and that means people who might be at risk of having COVID-19. because it's not just the capacity in the labs and the swabs and the reagent, it is the staff in the labs, and they're working long hours. We want to make sure that we are using that capacity to test in a way that helps us identify cases and then contain.
Also, I think it is worth pointing out that Korea has been used as a rule of testing, and relative to our population, I'm told that our testing rate is up there at the same level.
How long before you think
in the front.
You'll be aware that there are public health experts who say that unless we go to level 4 now, we're shutting the door after the horse is bolted, that shutting things down at the point where community transmission is confirmed is too late. Why aren't we there now? Why are they wrong?
And there are public health experts who have said we should be doing exactly what we're doing.
How long before Healthline is able to cope reasonably with the number of calls it's getting?
Sorry, how long?
Well, before Healthline.
Yes. If people who need to call helpline are the ones who call, then absolutely calls will be able to be answered at a reasonable pace. At the moment, the majority of calls are queries rather than necessarily directly about someone's current health status or health needs. We have increased the number of people on those calls. We're able to take calls. We've also, with our non-urgent, using other parts of the government system to help. The boost you will have seen as part of our COVID-19 package had additional support and funding directly for Healthline.
New Zealanders are taking this seriously enough?
They need to. And I hope, if nothing else, that New Zealanders listening today will see that this is incredibly serious. We are in a unique position, where if we move early enough and strongly enough, we can break down waves into much smaller clusters of cases. But it requires everyone to play their part. Government cannot do this alone. I'll come in the front.
Dr. Bloomfield, I mean, how concerning a development is it that you can't trace the outbreak for these 2 people?
Well, obviously, what we're looking for is if there is evidence of community transmission. Both the 2 cases are still under investigation. I think the key point here is this is why we are testing, is to find out whether or not there is community transmission happening. And the fact that there have been these thousands of tests now over the last few days, and so far there are just the 2 where we're still finding out if there is that international travel link, I think is important. But obviously the important thing is to find out early and then respond accordingly.
I think it is important to remember the magnitude of what we have asked. At the moment, we have 2 cases that may potentially be community transmission. They continue to be investigated by the Ministry of Health. In the meantime, we have asked for people to cancel all non-essential domestic travel. We've asked people to work from home. We're asking over 70s and those with underlying health conditions to stay at home as much as they can. We are stepping up the response. We need New Zealanders to help us.
Can you give an update, Prime Minister, on where NFAT is at in terms of flights, getting people home, that sort of thing?
I'll need to get the latest update on that. I haven't received one this morning, so my update won't be the most up to date. So let me go and do that for you.
All right. Just to clarify, are you asking MPs to follow your lead in place themselves and wellness?
And so this is why this morning I did speak with the Speaker. I want to make sure that the Business Committee, all of Parliament, comes together and makes some of these critical decisions. So MPs from across different parties to work through how we can make sure that government continues to do its job, the opposition is able to continue to do theirs, but that we are in line with the same advice that we're giving everyone else. So we're going to work through that together. We've got a recess which will allow us to do that. Just take a few more.
What's your message to young people who probably aren't at risk of dying from this, but are at risk of being quite prolific spreaders of the disease and perhaps aren't taking it seriously?
Yeah, and this is where the message of uniting against COVID-19 is so important. Just think about your grandparent. Think about someone in your family group or your friendship group who might have compromised immunity. It's not about whether or not you're worried for yourself. It's that you should be worried about those around you. So please take it seriously. This is about saving lives.
Why did you choose to do the Statement of the Nation approach to the information you've just given instead of the same way you've imparted all other decisions?
This is the first time we're introducing New Zealand to the alert system. So whilst from now on we may move up or down through the alert system, I really wanted to make sure that everyone had a clear insight into the entire framework. It's the first time we've shared it. It's the first time we've shared details around what it will mean for people. From here on, now that they have this information, they'll receive daily updates about where we're moving by either myself or the Director General of Health.
The Pandemic Plan and the Health Act actually provide for doing press conferences like this where you talk to all of us, not just one or two media organisations. It's about talking to the entire public. So shouldn't you continue to do it here?
As I am. That's why you'll see as soon as I finish, I've come immediately down here to face everyone and to answer questions. But this is about making sure that we can communicate with as many people as possible at once, and then make sure that we answer all of the questions that will flow from that.
If the investigation, why are we right not to go to level 4 now?
Because the current situation is, as outlined in the alert system, we're at level 2 and we believe that's the right place to be, and it's under very constant review. I'm talking very regularly with a range of health advisors, my own Chief Science Advisor and the Prime Minister's Chief Science Advisor too.
One thing I also think that we should remember is that this will be with us for some time. So we have to make sure that when we move, that we are able to sustain our response. This will not live in weeks. It will be here for some time. Okay, I'll take last question.
Are DHBs going to restrict access to under 10s? We've heard of a case where an under 10-year-old was denied access.
Denied access to
clinic.
For COVID or for another?
Just a check, a routine check.
Oh. We might need more details on that. That sounds a little vague. But is there anything general
Just a general
you can
comment.
say?
All the district health boards are looking at ways they can, as soon as they need to, increase capacity. And so some of the things that they are looking at, of course, is deferring elective surgery and deferring outpatient appointments. But they're looking at alternative ways for the latter. It may well be they can do outpatient appointments through telephone or video conferencing. So that's what they're working on right now.
Last one.
Two cases.
Sorry, you really have been waiting. Last one.
If the investigation into those two cases, the one in Wairarapa and Auckland, is unable to find any links to overseas travel, will those regions be put into alert level 3?
Oh, look, these are decisions that I leave with our public health experts, that exactly those questions are what they're working through now. They then provide us with advice and we move swiftly. So my message to everyone again, we are at level 2. We constantly need to be prepared that we may move very quickly up and down levels. It may be one region, it may be one area, it may be the whole country. Okay, everyone, thank you.